going to talk about pregnancy-induced hypertension, signs and symptoms of preeclampsia and eclampsia. So we all know what hypertension is. Just want to point out that pregnancy-related hypertension accounts for 10 to 15% of maternal deaths worldwide. So just to get some definitions down, chronic hypertension is present before pregnancy or diagnosed before week 20 of gestation. And then gestational hypertension is the onset of hypertension without proteinuria after 20 weeks of gestation. And is diagnosed with systolic blood pressure of greater than 140 or diastolic greater than 90. And then preeclampsia is pregnancy-specific syndrome in which hypertension develops after 20 weeks of gestation in a previously normotensive woman. So the management of hypertension, they manage it very conservatively and then usually induce at 38 to 39 weeks, so to avoid those complications. And then for the drugs, you have your Aldomet and then the beta blockers, and atenolol and metoprolol is associated with intrauterine growth retardation if used in the first and second trimester. And then we want to avoid labetalol because it may cause maternal hepatic injury. So some symptoms for preeclampsia, you want to ask the patient if they have a headache, blurred vision, dizziness, or epigastric pain in the right upper quadrant. And the first three, headache, blurred vision, and dizziness, are all from different types of edema. So the three cardinal signs of preeclampsia: elevated blood pressure, edema, which, remember, the edema, dependent and non-dependent. We do not want edema in the face or the hands, but in the legs and feet is normal. And then proteinuria is no longer used for diagnostic. So again, edema is normal, face and hands abnormal. Make sure to listen to the heart and lungs for fluid overload. And then you also, for the assessment, you also want to do the neurological assessment, the EOM from nystagmus, wiggle in the corner of the eyes, perla, deep tendon reflexes, clonus. Those are all indications of swelling in the cerebral from the hypertension. So make sure to check those like we did in class. So magnesium sulfate can prevent seizures in hypertensive women, but you need to make sure we know the side effects. It is a smooth muscle relaxant, so respirations can decrease, urine output decrease, hypotension. We need to make sure we monitor alert and oriented ×4, and the warnings of magnesium toxicity: sudden hypotension, decreased respirations, less than 12 respirations a minute, decreased urinary output, hyporeflex, so their reflexes are pretty much gone, sudden decrease in fetal heart rate. And if any of these happens, you need to turn off the magnesium and administer calcium gluconate, which is the antidote for magnesium. Here's just the different levels of magnesium toxicity. The only cure for preeclampsia or eclampsia is delivery. Get that baby out of there. And if she's still undelivered, it can progress to HELP syndrome and then DIC. And if all else fails, delivery, regardless of gestational age, if any of the ominous features are present, if it's getting worse and worse, we got to get that baby out. So some risk factors: age, very old or very young. If it's your first child, diabetes, chronic hypertension, or multiple gestation if they are having twins or triplets. And for the care for a woman with severe preeclampsia, we just want to limit any stimulants in the area. We want to make sure there's nothing that sets off a seizure. Daily weight, bed rest, magnesium sulfate, and then delivery. And just some of the medications for pregnancy-induced hypertension, like we said, magnesium sulfate, which prevents the seizure activity, and then to sedate them, also Valium, phenobarbital, which will also sedate them as well, and hypertensive medicines, Aldomet, Labetalol. So this is the progression of the disease without magnesium sulfate. It goes pregnancy-induced hypertension, preeclampsia, and then eclampsia with seizures. But if you have the magnesium sulfate, the ultimate goal is pregnancy-induced hypertension, preeclampsia, give them magnesium sulfate, and then to avoid eclampsia, decrease the irritability of the CNS system, which will be no seizure.